welcome to another episode of Chill with Bill at San Antonio Zoo. And today I have with me Dr. Truck Lee. Dr. Lee is a cardiothoracic surgeon, and we're going to talk a little bit about hearts today. In your super specialty training, what did you focus on that?
Particularly the mitral valve. So the heart has 4 valves, and the mitral valve controls the flow between the left atrium, the left side of the heart. So that's a receiving chamber, and then that allows blood to come back from the lungs that are oxygenated, and that directs the blood to the left ventricle, and then it then goes to the rest of the body. So,
and as I understand it, sometimes that mitral valve will kind of wear out, and then that's where you come in. What do you do?
When we talk about the valve malfunctioning, what typically happens is that patients can develop symptoms like irregular heartbeat, called atrial fibrillation. They sometimes develop symptoms like shortness of breath. They can develop symptoms like chest pain and lightheadedness as well. So our goal here is to go and fix a mechanical problem. My specialty training in that was really geared towards fixing that valve using the patient's native tissue, reconstructing that tissue, and rather than replacing it. But yeah, you can either repair it or replace it. We believe that repairing will offer patients better survival benefits long-term. And so that's where my focus is.
Dr. Lee, tell us about the dedicated cardiovascular unit, and why is that important?
Yeah. So when we talk about cardiovascular disease, it's the second leading cause of death in the world. And in the United States, when you look at in the 90s, the incidence of mortality was about 12 million. And then since the 2015s, 2017s, that number has grown to about 20 million. So the prevalence of cardiovascular disease and related mortality has grown as our population has grown. So how do we as a healthcare system address this increasing prevalence of cardiovascular related deaths? And in particular, when we talk about how do we grow as a medical field to address the needs of a city like San Antonio that's growing, how do we improve access care, and how do we deliver that care? When you talk about cardiovascular ICU, it's essentially a super specialized intensive care unit with coordinated care with our cardiologists, our intensive care unit physicians, as well as our nurses and respiratory techs. So technology is constantly growing. There are more mechanical assist devices. The ability to detect these diseases earlier is better, and then to how to manage the arrhythmias and complications associated with cardiovascular disease. So cardiovascular ICU essentially has been very important when it comes as a role to decrease the mortality rate associated with this disease process itself.
So Dr. Lee, I know you focus on mitral valve. What in particular? What do you specialize in?
Like I mentioned earlier, trying to use the patient's native tissue and using their own leaflets to reconstruct and repair it rather than putting in a foreign type of prosthetic in terms of a replacement for that valve. So in particular, I focus on the repair. Now, the standard has always been to do these surgeries through a full sternotomy, meaning that where you cut the breastbone from the notch here all the way down to your xiphoid process. So that's relatively a big incision. Recovery takes up to 3 months, and there's significant pain associated with that. And we see that there is a longer time to return to daily activity as well as a longer time to return to work. And so what we've done here at North Central and in particular with my practice is that we're trying to make these incisions even smaller. So what we are now focusing on is minimal invasive mitral valve repair or replacement. And we're able to do that through a small incision on the side, about 6 centimeters. And so now we're seeing patients are going back to work sooner, going back to their daily activities at home sooner. Pain is significantly better, especially in in a time of where we have opioid epidemic crisis. So we're trying to limit narcotic use and give them back to their families sooner.
Dr. Lee, I want to thank you for coming out to chill with Bill this morning with the spectacled bear at San Antonio Zoo. Learning the fact that they have heart disease too. I hope they're not on your calendar or your work day anytime soon. But thank you for coming out and spending some time with us.
Always happy to chill with Bill.
Today we're here with Kurt, the speckled bear. Yeah. And this. Yeah.